Well, a lot of the data from the twin studies research effort, and there were a number of biochemical and genetic and functional studies that were done on Mark and Scott Kelly, with Mark as a control and Scott in space. Most of the data from that is still being collected and analyzed, so can't say too much about that at this point. But what we can say is that when Scott returned, he was very fit. He was very able to readapt to a 1G environment quickly and become very functional very fast. So from a 1 year in space perspective, he did very, very well. There are a couple of things of concern. The one that I find that we're pondering most now, I would think, that's pretty safe to say, is the symptoms that Scott had with regard to touching things and having things touch him. He was very sensitive to touch, especially in weight-bearing areas, and had discomfort in his feet walking and in his areas that came in contact with seating that he was sitting on, and so on and so forth. And that bothered him immediately. And as of a couple of months ago, he still mentioned that he had some skin sorts of discomforts, even several weeks after the mission. So I think it's fair to, at this point, ask the question: is that going to be a persistent thing? Is that a one-off phenomenon, or does that represent, like the vision and intracranial pressure problem that emerged several years ago? Is that yet another unknown that might prove to be an issue that needs to be addressed in the future? You can imagine arriving at Mars and after a prolonged planet-to-planet journey, interplanetary journey, and then having to go into a planetary EVA suit and perform EVA. The question is, if those symptoms are consistent in more than Scott and with other folks staying in space for very long periods of time, would that pose an issue with planetary EVA? I actually asked Scott that question in private, and he said, well, coming back to Earth, it was not an issue, but if you're going to Mars, it very well might be. That's how much it affected him. So I think that deserves some attention going forward.